This is Laura and Theresa with another episode of Ask Me Anything. This week's question is regarding training. Theresa, there seems to be a lack of training in the dental office and it's causing a lot of drama and dysfunction. Where do you believe the breakdown is starting?
Well, anytime that you have an office full of people, there's going to be drama and there's going to be conflict. The real way to get ahead of that is by setting expectations and boundaries right from the hire date. What I see often when we have these kinds of little dramas and things like that is the fact that the expectations were not clear, the job descriptions are not clear. So someone thinks someone else was supposed to do that, or I didn't have to do that because that was her job. No, I didn't. That's never been my job. It's always been Sally's job. So then there's this round robin of, who did it or who didn't do it, in other words. And
Right.
so there's a lot of drama with that. And then the doctor doesn't know what to do about that. They're just trying to keep, the chairs full and everything moving along.
Well, I've heard you say that there are two parts to the training process. Is it the how and the why?
The how and the why.
How do you go about bringing those components together in your training?
Well, so again, we're having good written policies and procedures, and I constantly say that because it constantly needs to happen. If we don't have things written down, just like our documentation for our patients, if it's not written down, it didn't happen. If you don't have written policies and procedures, which is going to be the how, I could walk into any office, I should be able to rather walk into any office and pull up your training manual and step by step know the mechanics of how to perform that job. Just like if I were to go into McDonald's, I can guarantee you there's going to be 50 pages of training documents step by step on how to make a Big Mac. I'm not going to have to guess. It's written down. So the how is the mechanics of things. The why is a little bit harder to kind of put a finger on and nail down for a lot of places, because the why goes back to what is the vision for the practice? What is the mission for the practice? What is the culture of the practice? Are we a clinic and we're just trying to see as many patients as we can? Are we a high PPO office and we're not going to make production unless we do high volume? Or is the why more about really elevating the patient's whole health and raising the standard of care, education on the patient? Do we have an ortho practice? Do we have a high-end cosmetic practice? Those are going to attract a different type of patient. And so the why is different than the how, but equally as important.
Yeah, absolutely. Those are really two important components to setting your team up for success. How do you go about, so if you have the how and written policies and procedures, how do you have a system around the why?
Well, that also is, that conversation happens on hiring, on interviewing. Right now, practices are so low on good qualified team members that it's basically if you've got a temperature and a pulse, you're hired. And then you're just put there. Here, you're the new office manager. Here, you're the new receptionist. No experience necessary. You can train someone, absolutely, and I've done it, that has no dental experience.
Absolutely.
If a couple of things are in place. One, they have to have some common sense. You cannot train people on how to have common sense. And they have to have critical thinking skills. So those things are so important because they are going to be thrown into situations that they're not familiar with from a dental aspect. from a healthcare point of view. And so can they think on their feet? So rather than just hiring the first person that walks in the door because we need a warm body in this chair, take a little bit of time and hire the right person, even if they're not dentally trained, because you can train them mechanics.
That's right.
You know, and even the why you can train them. But
I'm going to put in a little plug right here. If you don't have a system, we have a course called Building Your Dream Team, and it takes you through those steps. And like you said, you don't necessarily have to hire to a fully trained person, right? Especially if they're not available or your practice can't afford that. What you do need to have dialed in is an incredible training program so that when you get that right person who shares the values of your practice, you can onboard them properly.
Exactly. And I have dealt with many, many, many practices. And I can tell you that if I go and I ask their team members, what is the vision for the practice? Most don't know that there is a mission statement or a vision, or, you know, why do we do what we do? And sometimes even asking the doctor, you know, doctor, what is the vision for your practice? It's hard for them to
Theresa,
put
are you
those
trying to
into
make
words.
me plug all my programs right now?
Or mine, either way, you know.
We both have incredible programs. Theresa, you have your snapshot, which gives a really great overview of risk assessment and risk potential. But when you start getting into that, these are the nuts and bolts you get into, right? The training, the leadership. I mean, you can't have one without the other. So you're absolutely right.
Yeah, you can't. And, you know, it's so important to, again, go back to the what and the why, or the how and the why, because without the why, the what is just, it's just repetition. And we don't know why. We don't know why we're
Well, if
making
they
sure
don't
that
know
we're
why,
probing.
sometimes that's when corners get cut, right?
Oh, corners get cut. Yeah, big time. If we're talking infection control, let's just use that for a topic.
Yeah.
And we know that we need to set up a room a certain way, or we need to process instruments a certain way, but we weren't really taught why we need to process them that way. And corners get cut, and you know, maybe the sterilization protocol isn't 100%, but it's 90%, which is good enough. Well, not when you're talking about unsterilized instruments. Why is it okay not to drop something on the floor and pick it back up? Well, you would be surprised. It seems like that's a funny, trivial thing, but it happens. And it happens because you don't understand why. The 5-second rule doesn't count in healthcare.
Right.
You know?
I was just going to say.
That is now a contaminated instrument, and that does not go back on the tray. That does not go even on in the tray prep area now, because you've now, you know, contaminated that whole area because you've just, so they need to understand why.
I love that you use that example because that's a great, right? We've lived our whole lives with the 5-second rule. Most of the time, it really doesn't matter. But really training to these ideals, and that's just such a great example. The how, the why, the two important components to setting your team up for success. All right, well, email or DM us to get answers to your big questions in your dental practice, and join us for another AMA next week.